Hi, I'm Inez, and I live in Durban, South Africa. And I was playing water polo about a week and 5 days ago. And we're playing against a boys' side before we were going on tour to Grahamstown, Mukunda. And we were playing them as a practice match. And I went to defend a boy, and I thought he was going to pass the ball. And he kind of shot through with the ball and kind of had like full force onto the back of my hand with like the bottom of his elbow. And then a few days went by and it was swelling quite a lot. And then I went to go see the sanatorium at my boarding school, and they said, no, it's just soft tissue swelling. It will go down, it'll be fine. And then my dad came up to take me for an x-ray at Hilton Life Hospital. And then I have a crack fracture or hairline fracture in my metacarpal, and my knuckles started to bruise all along my fingers. So now I'm kind of just, the swelling's gone down, but I'm kind of just bruising everywhere along my hand.
So the tools that we're going to be using is the Spectrochrome laser, which is coherent light. It's green, which is in the middle of the spectrum, so it can help bring the body more into balance. So if there's an area of the body that's more overactive, it can help settle it down, or an area of the body that's more underactive, it can help bring it up. So I like to use the green laser in the field. In this opening sequence, I'll show you the setup. I'll have it above and below the head and feet, just kind of trying to get that center of the body nice and straight. And then when we go to work on the hand, we'll probably shine that more on the hand specifically. But I like to use crystals to represent the body, just so that I can have kind of a visual representation of the body in certain ways. And I also think that crystals help kind of boost the energy field as well. Quartz is an amplifier. It's used in a lot of equipment because if you add a frequency to a quartz crystal, it will amplify that frequency. The tuning forks, the tines are slightly spread, and I find that makes it a little bit easier when you're striking the tuning fork, so the tines don't clang together. So that's the one that I use the most often when I'm tuning. The other thing that I use when I'm working is a pendulum. And so this is a plastic ball on a string, so it's neutral. They can call this a neutral pendulum. Sometimes if you have crystals, then they'll have a particular charge. They can really pick up electricity. So using plastic, then it can be neutral, and whenever you're hitting different things in the field, you can find it shifting and moving a lot.
So I have over here, this is indicating the dorsum of the hand. So we've got the thumb, and these aren't fingers, these are actually the metacarpals. And then I'm representing the fracture with this crystal over here, and that's the palm. And then we've got the radius, the ulna, and the humerus. I have my tuning fork, and then I've got these two crystals, which I'll use later in therapies. Now this pendulum, so it's calibrated to me. When I first got my tools, I didn't have the course, I hadn't started the course yet. So I played with them, and I'm glad that I did, because when I played with them, I started to realize, oh, okay, this pendulum is telling me what's a nerve, what's bone, what's tendon, what's joint, what's inflammation.
All right, well, and this is when you get to lay down and relax. And while you're getting settled, I'll just kind of show my setup here. So I have a stone representing a point down below your feet, which we call the Earth Star. When I have the tuning fork, I note that that's when I'm halfway over this stone, then that means that point is in place. Same thing with this crystal here above the top of the body. This crystal represents the body, and this is going to be the full body here. Kind of shrinking things down so that I don't have to use up too much space. I'm going to have the Spectrochrome laser pointing down below the feet, and then also above the top of the head. So we have these, like I said, these two stones represent that fracture I have been able to see the x-rays, so I have been able to kind of wrap my head around, the fracture, what it looks like. But now I'm just going to be representing that fracture where these two stones kind of come together. I'm just holding the tuning fork there.
So this is just going to be giving that fracture that feedback that it can heal. Now, the amazing thing about green light is that it will heal fractures in days. In 4 days, you can heal a fracture with using the green light.
Robyn,
Yeah.
I had like this like tingling sensation all the way down, like from my elbow to like my thumb and like my index finger.
Okay. Yeah. So
Yeah.
that just shows you. And anything else that you felt?
Like at the beginning, tingling coming down, like just the right side of my body, like all the way from my toes, like to my thumb, not necessarily my index finger.
Okay.
At the bottom.
But now you're feeling it in your index finger right where I'm working. Sure. Ines, that was quite a long session because you had both of us.
Yeah.
How do you feel?
Yeah, I felt good. It was like a weird sensation though. Like at the start, like when you started, it was like coming all the way from like my feet, like just the right side of my body though, like the left was, and then at like a point when you're working on my elbow, then the like left side of my hand, like further away from the fracture, was like almost like ringing, and then I started to get it like all along my thumb, like from like here all the way along my thumb, and then it started to like go into my index finger, and then the tips of my fingers were like I don't know, it felt like not like throbbing, it was like ringing almost. I don't know how to explain. Yeah.
They're alive. Okay. No, that's really great feedback. Do you have anything to say about that, Kim?
Well, I'm just grateful that you're giving it a go, and I'm thrilled that you could feel some sensations, even though we're not there physically, that you can feel us working from a distance and shifts and movements in your field. So I'm loving this.
I'm loving it. Let's look at your hand movement. Can you open and close?
Yeah.
Feel better?
Yeah. Less like stiff, like pulling.
Okay, good. Yeah, so you should have a feeling of more space. So particularly in the wrist area, this area should feel like there's some more room to move.
Yeah.